Let's learn today about diabetic nephropathy in the single flow chart. So diabetes mellitus is a condition जिसमें you have an excess blood glucose which starts to get into the urine, which is called as a glycosuria. Now this excess blood glucose causes the glycation of the basement membrane of efferent. Glycation मतलब this glucose molecule will start to bind to the basement membrane of efferent arteriole. Efferent arteriole is the one जिधर से blood exceed कर रहा है and afferent arteriole is the one जिधर से blood enter कर रहा है. As there is a glycation of the efferent arteriole, it starts to become thick and stiff, which is also called as an hyaline arteriosclerosis. Now as this efferent arteriole is thick, the amount of the blood entering from the afferent arteriole, the same amount of the blood can't leave the efferent. There is the obstruction of the blood flow. As there is an obstruction of the blood flow, either blood will start to get build up and there will be increase in the pressure of the glomerulus. As the pressure increases, वो filtration process को speed up करेगा and GFR increase करेगा. Initially this basement membrane is negatively charged, जो basically negatively charged albumin को repel करता है and it is no more getting into your urine. But because of the thickness, there is a structural damage जिसके वजह से charge lose कर देता है and there is no more repulsion to the albumin and albumin starts to get into the urine जिसको हम बोलते हैं albumin urine. Now there are this particular cell जिसको हम बोलते हैं mesangial cells. Mesangial cells are the one जो basically glomerulus को structural support देते हैं. As pressure increase होता है, it further stimulates the mesangial cells and mesangial cells starts to release the more structural matrix. जैसे structural matrix increase करता है, there is this glomerular expansion. The structural matrix further develops into the nodule जिसको हम बोलते हैं chemistral Wilson dot. As this glomerulus starts to expand, there is this disruption of the podocytes जिसमें this food processes of the podocytes undergo the effacement. मतलब this food processes will be getting flat and will be merging with the basement membrane. As this filtration slit gets widened, the albumin and the globulin will start to get into the urine, which is also called as the protein. Now because of the excess glucose, there are the structural changes of the nephron for the long interval of which gradually damages your glomerulus and there will be ultimately a decrease in the GFR and which will be resulting in the low urine out. This is what actually occurs in the diabetic nephropathy.